Good morning, power hitters, solar warrior tribe. Today is Tuesday, September 6, 2022. My name is Jarrett McAllister, your co-host, mentor. I'd say alongside my main man, but he's out, I think he's furniture shopping for that empty pad in Vegas of his. No, he's actually, he's on the road driving back. He might hop on as a secret squirrel over here on the Zoom call while we're doing our thing, but I will be holding it down for now. So I guess my main man's Tom Cotter. You're going to be my main man
I'm
today.
your main man today.
Cool, bro. Cool. So let me go ahead and share my screen. And then, yeah, let's get this thing kicked off. 1 second. All right. Everybody see that beautiful screen?
I see it.
All right. You see it. You see it. So as we kick off every Tuesday meeting, let's jump into some success stories. Anybody have some success stories? Go ahead and raise your hand. You know, maybe a new recruit, close some sales, but don't just say I closed some sales. Tell us like how you closed the sale, right? An objection you had to overcome so we can learn something from that.
Go on, Jared.
What's up? Anthony Bonilla, top 3 seller, crusher in the industry, just blowing it up. What's up, man? How you doing?
Good, thank you. So I just helped a tier 1 mentee close a project, and they actually owed $2,000 to SoCal Edison. So I learned this little tip from JC Rangel. So what we did was we told the client that we could have his wife be an ambassador on his own project. So he earned $1,000. We're gonna give him a $500 homeowner rebate check, which we added on the adders, and then also the consultant and myself will give them the rest, $500 cash after install. So that's $2,000 in total that could help in paying off the $2,000 he owes to Edison. So was he hooked? Obviously, he was so excited, and then we helped them reduce that bill with solar, right? But just a little tip that, you know, what the consultant and I learned from JC Rangel.
Right on, man. No, that's cool. Just getting financially creative to make that happen. You could have done what, like, you know, I think what my dad would have done back in the day, just throw it in your kid's name, the utility bill, right? You know, when the bill gets too high. Just joking. No, great job, Anthony.
Hey, I just want to add on real quick. And you're able to adjust the margin to be able to make all that stuff happen, right?
Yeah, I know that. But we want to be a little more creative.
What I'm saying, Anthony, though, is you have that we as power professionals can be very creative because we have that ability to create the system in order to make it good for the homeowner to go solar.
Yeah, absolutely. And I think one of the major benefits of how he played it out, rather than just coming out $2,000 out of his pocket to get the deal done, obviously there's tax implications for that, right? So as the ambassador, money goes straight to them, doesn't go through Anthony, as well as the rebate check. So no, that was very smart way to get creative.
And we got to
Mark. Yeah, right on, man. Mark, I see your hand up, brother. You got a success story you'd like to share?
Hey, yeah. Can you guys hear me okay?
Yep.
Awesome. Yeah, I wanted to real quickly go through my big win this morning. I did my first site survey in Cincinnati, and it's in the 45208 zip code, which is, you know, maybe 10 minutes from downtown. It's a very affluent neighborhood. It's a really like proud zip code to be able to say I'm putting glass on the roof. Unfortunately, the site survey didn't go perfectly. I tried to do the virtual one. I tried sending him the link. We had some technical difficulties, but I finished it. It's good to go. He also has an Airbnb property a street over, about a block away, that he's going solar for too. So it's a long time coming to get Ohio open, but that's really exciting. All the docs are signed. So I'm excited to get those 2 done with. And yeah, that's pretty much it.
Right on, man. Great job, brother. Yeah, I mean, that's exciting, pioneering a new market. You know, it takes leaders like that to, you know, help grow these new markets. So great job, Mark. Anybody else have a success story, something they'd like to share from over the Labor Day weekend? Ricky, you got your hand up. Go ahead. Ricky going once. Ricky going twice. All right. Anybody else? If
I got a
Ricky-
quick story.
Okay, Bradley, go for it.
Hey, sorry, can't have my video on right now, but yeah, I had a customer who I signed up a couple weeks ago, and we had some docs issues. So Vivint guy door knocked him, and Vivint like contracts out local solar companies. He went with Vivint because they gave him like over 3 years a $3,000 discount off of his Vivint alarm, which I asked him, I was like, that's kind of wild that they can discount your alarm system $3,000, but that's neither here nor there. Anyways, I just essentially had to go back and repitch the customer the value of, you know, a nationwide installer, the best warranties in the book, even though our price was pretty similar. You know, our warranties and recognizable nationwide influence really kind of pushed them over the edge, including our relationship that we had built over a few meetings. So that was a good win.
Awesome, man. Yeah, anytime you can, you know, I'm an OG ADT rep, so I've never liked Vivint. Okay. Like I've been battling with Vivint for like, I don't know, 10 years or so. So anytime you can take a deal away or back from Vivint, it's a good day in my books, man. So great job there, brother. Ricky, I see that you're back on.
Hey.
Might have had a technical difficulty. We'll go ahead and do you, and then we'll do Anna, and then we'll do Bill, and then we'll move on. So Ricky, go ahead, share your success story with us.
Yeah, I had a good install over here in Menifee, California, in the county area, big property. Wally Rita helped me out on it. It was a big success. Learned a lot, and well on my way. So that was my Labor Day weekend story of joy.
Sweet, man. Great job, brother. And Wally, you know, one of the top mentors in the company. I've always kind of wanted to throw a deal in there and assign Wally to it just to see his secret sauce, to see what, you know, what he's up to, man. But that's great. You're learning from one of the best in the industry. So great job, Ricky.
Yeah, well, what it was singing karaoke the night before, and then doing the deal.
Nice.
So shout out to Wally. Shout out to Wally.
Yeah. There we go. Wally World in the house. Anna, you have a success story? Oh, you're on mute, Anna. Go ahead and unmute yourself first. There we go.
I have a problem with the DocuSign. My lead, she trying to sign the DocuSign until the page 8. And the first question on the page 8 on the DocuSign, it says, click to see if you qualify for low income. So when she click everything on the page 8 and then she click next, and it come back in the same thing, and it's empty. It says, click to see if you qualify to for low income. So it keep come back on this page. So I said, go ahead and scroll down to the last one, finish it, and go to the last one, see is anything show finish. So she can click on finish, but it's not pop up. It's nothing pop up, only the button pop up is a next button. So when she click next, go back to page 8 again. So it go back the same, so she cannot be able to sign up.
Okay. So, I mean, success, it sounds like you sold a deal. All right.
Yes.
So you sold the deal. Sounds like you're having a little bit of technical issues. Anytime anybody mentions the low income solar, I have no clue. I just kind of blow right through that. That's me. I've never dealt with that. You might want to work with your mentor or, you know, email customer service.
I did.
But yeah, that would be something we can handle, you know, or maybe even after the call, if somebody has some tips for Anna, you can message her privately to help her get through that one. But great job on closing your deal, though.
Thank you.
You're very welcome. Bill, did you just disappear? Are you still there?
No, I'm still here. I just lowered my hand on purpose. Just want to share the value of BNI and ambassadors. I think I referred to a gal I signed up last week who had been in my BNI group, or I've been in her BNI group since I joined, who signed up, but she's away on vacation with one of her girlfriends this week, and somebody else she had referred to me who we just never could get together, and she kept putting it off and everything. She says, hey, I'm with my friend. I can't remember her name right now, but she's ready to go forward. So I just really utilize your resources of those people who are warm referrals because they're the best. This will end up in a deal, and I couldn't be more excited about the whole concept of the ambassador program and of working BNI as well. So cheers for that. I also met with the local building officials this past week on a deal I've been trying to get final on a 27 kilowatt thing that's been in the city, and we met with the plan supervisor, the electrical plan checker, face to face, the owner and I, and got it finally done. So hooray on that.
Great job, Bill. Way to work it, man. And yeah, BNI definitely works it if you work it. Don't expect success overnight. Some people do, but I think it was what, Anthony, I think you were in it for like a year before you got your first lead, but then it starts to trickle. You get the reputation. So great job. And then I'll just share one quickly as I was thinking. Last week I was on fire. I had my first 4 appointments of the week last week. I went 4 for 4. Unfortunately, on the 4th one, they didn't qualify. Ran them through Mosaic, ran them through Goodleaf, just didn't work out. But they were shocked. They were like, our credit should be good. So they were going to do a little research to see what's going on with their credit. Anyway, we built such a great relationship with them. They emailed me and the mentee the next day and said, hey, we found there was something on our credit. We're going to get it worked out. Should be, good to go in about a month. In the meantime, though, I have 2 people for you guys. So they gave us 2 leads, and we're going to be setting those up this week. So just goes to show, man, you just give it your all every single time, no matter what. And yeah, we're going to take a no deal into 2 deals, and then potentially a 3rd when the credit gets ready. So figure I'd share that with you guys. With that said, let's move on. But great job to everybody that had success over Labor Day weekend. Hope everyone's well rested. We're in September. And shout out to all the winners in August. It says Jonathan Bernasso just kicked a bunch of ass last month. Number 1 in sales, number 6 in referrals. Shout out to the other twin, I think the better looking twin, Chris, who was number 1 in referrals for the company last month. And then shout out Cynthia, number 1 mentor. She knocked me off my place from the previous month. Cynthia's always crushing it, helping out others. You got Wally, number 2. Just really great job to all the winners, top 10s in all categories for last month. With that said, I know you guys know that there has been a great contest going on. First place is the Fisker Ocean. You got top 20 going to go out, change their lives, change other people's lives, go build a home. And then Sonata. And then we're giving away tons of cash. Right here is the top. Well, I think this is 12. What is this? Top 11 through 56 or something like that. Anyway, tons of names on here. Everybody, a power hitter, solar warrior trap on this list. But then here we go. Top 10, which is impressive to say the least. I don't know what Jonathan Bernasso did to get all those points. I don't even know if it was ethical what he did. Just joking. Joel hitting number 2. Shout out to my boy Joel. That is super impressive. Mentor out in Florida. And then Jordan Shaw holding it down solid with number 3, man. So shout out to everybody there. In 2 days, God, I cannot believe September 8th is in 2 days. Power Hitters Top 20 is going to have. Whoa. Yep, sure. It's going to be down in Ontario, Top Golf, going to hang out, have some fun, maybe a couple cold ones, hit some golf balls, celebrate all the success. So if you can make it and you're in that top 20, come on down. And then future training. So obviously today we have Erin from Clearwater Health Insurance, which is exciting. Anybody who's been in the 1099 independent contractor space for a long time knows it's tough to have health insurance when you're not an employee. So this is very exciting class that we're going to have going on today. Wednesday we have the master class, updates, new slide deck, huge CEO call, so make sure not to miss that one. Every single Monday at 9 a.m. Pacific, you can connect with JC. He does his training Monday mornings. And then every Monday at 5 o'clock, we have our Power Hour company call. Make sure to recruit, invite guests. And then we don't have a training for next Tuesday, but we'll be talking with the leaders, topic of discussion. I was talking to Burton also. I want to talk about composition shingles, inlays on clay tile roofs and different types of roofs. Might want to revisit that topic again. So if you have any ideas, go ahead and put them in the chat. And then before we finish, Tom, I do believe you had some words and some, something you want to share with us all.
Yeah, thanks, Jarrett. I just wanted to share a little bit of the state of the solar union type message, and if I can tie that in with health impacts of dirty energy. So let me let one more person in here. They keep coming in. We're over 120 now. Oh, getting up there. So our solar energy revolution that we're in continues to gain momentum. Solar panels have dropped in price by 50% in the last decade. And today, over 4% of US electricity comes from solar energy, which is more than 80 times its share a decade ago. In Q1 of this year, solar accounted for 50% of all new power plants coming online. And we have close to 3.5 million solar systems installed in the US. And unless you've been living under a rock, you know about the Inflation Reduction Act, which became law in August. That authorized $369 billion in funding for climate change related and clean energy initiatives, including what we all love, increasing the solar tax credit to 30%. And yet, while we are rapidly transitioning to clean energy, power generation from unhealthy sources is still dominant. Pollution from the burning of oil, gas, and coal to power homes, fuel our transportation, and make our stuff results in the death of nearly 5 million people each year. That's bad, but in addition to that, about 100 million people are made sick by these dirty, expensive fuels. Now consider that that's 1 to 2 people out of every 10 people that are suffering health problems as a result of how we source most of our energy. And the economic cost we pay from fossil fuel production is estimated at $8 billion a day and climbing. So the deaths, health problems, and costs associated with digging up and burning of these last hours of ancient sunlight buried under the ground continues to increase each year. As thousands more go solar, that clean energy is saving lives. It's improving people's quality of life, and it's saving billions of dollars. Some people, especially as you read through Facebook, some people say we'll never be able to break our addiction to dirty energy. But the 125 people on this Zoom, that ain't us. We are the believers. We are the pioneers. We are the heroes in this story who are reinventing energy one roof at a time. Power on, my friends. Back to you, Jarrett.
Hey, right on, Tom. Thank you for those beautiful words of wisdoms, updates. And man, you guys, if that doesn't resonate with you, right, and get you fired up, it just to know you were at the right place at the right time, making a true impact. Not just in the world, the community, but with our own families and lives. It's a beautiful thing. So truly blessed to be in the position that we are in. Thank you for sharing that, Tom. That was great. All right. With that said, we are going to move over to our topic of the week. We have Erin Gant from Clearwater Health Insurance, who's going to go ahead and kind of break down these exciting new health insurance options for all of us independent contractors. So, Erin, are you online?
Yep, I'm here.
Oh, thank God,
hey,
because I didn't know if you were. Because if you weren't, I was going to be.
Yeah, you just hop into healthcare. Tell everybody about healthcare. Nice.
Yeah, go ahead. Feel free to share your screen.
Yeah, sure.
And then, go ahead and take control of the reins.
Okay, can you guys see this?
No, let me stop my share. Sorry
Okay.
about that.
Yeah, no worries.
All right, we should be able to see you now.
Awesome. Can you see my share?
Looks,
Here.
yes.
Yeah.
Yep.
Presentation there. Here, I'm actually going to stop for 1 second. I want to go ahead and I guess introduce myself first. Thanks so much for having me on. That was awesome to hear about all of the awesome things that you guys are doing. You know, every time I get onto a Powur call, I feel like I'm just feeling real empowered. I guess you guys have all of these fun words that you can throw power into, huh? But no, I feel inspired and, you know, ready to go for the day, because it sounds like you guys really are able to talk with each other, do a lot of teamwork, really find ways to help each other out, sharing your experiences. I loved hearing from, you know, Anna, Bill, Anthony, super cool, all the stuff you guys did just in the past week. So glad to be on here. I'm going to go ahead and throw my information into the chat here so that you guys have it. I also went ahead and put in the website. It's www.myagenthealth.com. And so that is going to help you figuring out how to get a quote, explore plans, really, you know, take that next step to find the right healthcare for yourself. And so what I'm going to do today is just spend about 20 minutes going through, giving you guys a good overview of the healthcare that's available to you through this new partnership between Powur and Clearwater. Really, really incredible. And then we'll hop into some Q&A right afterwards. You guys can ask me any questions that you want, and then I'm going to get you guys out of here with enough time for some closing comments and things like that. So looking forward to hearing what questions you guys have.
Cool. And just to let you know, Erin, we typically try to wrap things up about 11 o'clock.
Yep. Yeah.
So, all right.
I'll probably
Perfect.
wrap it up a little bit earlier than that, just to make sure that you guys
Time
can
for
make a
questions.
couple little like last minute comments and stuff like that. Okay.
Perfect.
Cool. And so let me go ahead and share my screen. Again, Clearwater and Powur. This is your official healthcare partner now. Clearwater, we've been around for a while. We, you know, began with a mission to get healthcare to self-employed individuals, figuring out ways to make it affordable and high quality. There's a lot of things that are available to people with, you know, a W-2 job. Typically their employer takes care of that. And then when you transfer into this space where you want to work for yourself, be self-employed, really get out there and build your business, one of the biggest things that's so hard is finding really quality, affordable healthcare. And so we are doing that. And by partnering with Powur, this allows you to get this at a really amazing rate and make this available to you guys. I'm sure that the place that you guys go right now and maybe are more used to going is healthcare.gov. And so healthcare.gov is great. It can be a little bit confusing. When you go on there, there's all kinds of plans available. I can tell you right now that healthcare.gov, we will save you with our innovative plans almost 60% on your healthcare if you're making more than $50,000. So right off the bat, if you're making more than $50,000, if you are planning to make more than $50,000, we will be saving you a ton of money, you and your family. On the flip side of that, we'll be saving you most likely in general, no matter what. And so we have a wide range of options. You can think of Clearwater as the group that you come to get information from and sign up for these plans, okay? Clearwater is here to help you. We have benefit consultants, and I'll go into that in a little bit here, but benefit consultants that are available to help you all the time. It is so easy to book a call with one of them. We have 3 different options of things that will help you out, and we'll figure out what plan is going to be the best for you and your family based on your current needs, how much you're willing to pay. and all of that. And so we've got these three big sections, right? Our innovative plans, which we have created and are really, really incredible. They have copay and HSA options. There's 3 different plans that are fully customizable. They also have 2 PPO networks attached to all of those plans. So really, really incredible network. It's a low annual max and a low monthly premium for those, okay? We also have access to all of your traditional health insurance as well. So all of the plans that are available in the marketplace, there's no extra cost going through us. If one of those plans is going to work better for you and your family, we are going to let you know if it's more affordable or if you're going to get a better quality plan that way, right? And then also we have supplemental insurance available too. So dental, vision, accident, critical illness, and life. Dental and vision, you can have those just by themselves. So if that's something that you're looking for sure, reach out to us. Accident and critical illness, y'all, is so amazing what's available to you. You get paid out in lump sum amounts of money that cover things that are happening right then in the moment. So I definitely encourage you to look at those options. We are going to spend most of the day talking about those innovative plans, but I do just want you to sit here and ask yourself, you know, am I on the right plan? Am I on the right plan for myself and my family? I'm going to try and give you an overview of how to figure that out. And I'll just let you know, starting off with, you know, 70% of Americans are on the wrong health plan. And that can be from a range of different things. They might be on a plan that is only good for like the day-to-day stuff, right? Maybe you can get your prescriptions and you can get go to the doctor or something like that, right? But you don't have really great care for when something big happens, like what that out-of-pocket cost is, that financial risk that you're taking on when something big happens to you and your family. The other side of that is that you might be on a catastrophic plan, which means that you literally have nothing for that day-to-day care that you need, right? And you only have it if something really bad happens. And so what we wanted to do is bridge that gap, bring those two pieces together, giving you really good healthcare for that day-to-day stuff. So that baseline, what you need, your preventative care, your teledoc, your mental health care, your prescriptions, making sure that you weren't spending a ton of money on that side. And then also make sure that we're decreasing your financial risk. And so what I would suggest, and I'm just going to say this at the very beginning, and I'll probably say it a million times throughout this presentation, but when you go to myagenthealth.com, you'll see right there, it says book a call. Book a call. No matter what health plan you're on, it is so good to talk about your health plan. See if you're on the right plan for you and your family. I know right now on this call, we've already saved a ton of people money on their healthcare. You know, Chris Bernasco, he just signed up as well. So you guys have a ton of leaders that have already taken the plunge and gotten better healthcare. They're already saving so much money on their healthcare. With that, our benefit consultants are fully licensed. They are there to help educate you on your healthcare, help find the right plan, and also be there to, you know, look up your doctors, make sure they're in network, compare and contrast your different plans, see if the plan that you're on is the right plan for you right now. And so most of our customers, they come to us, almost 85% of them will hop on one of these innovative plans. Another 10%, we're going to set up on a traditional health insurance plan, and that might be due to some pre-existing conditions or that. And then almost 5% of them, we tell them to just stay on the plan that they're on at the moment because it's affordable, it's working for them, it covers their providers, that kind of thing. So definitely you can have trust that we're going to be there to make sure that you understand what's available and what's best for you and your family. And so just on a very high level, you know, we came into this with two big things, the affordability piece, right? and then the quality piece. And so when it comes to affordability, our members on average are saving almost $10,000 on their healthcare. They're saving that on all of their fixed medical costs, but then also their out-of-pocket costs. And so we're saving our members 80% on those out-of-pocket costs. That means that when something big happens, we are decreasing your financial risk by 80%. And I'll tell you how we do that here in a bit. But like really, truly, you know, when it comes to something big happening in your life, to your family, to you, we are there for you. You have healthcare that you can trust. And then the other side of that is the quality of your healthcare, right? And so one of the biggest things that our members always say is, you know, when I talk about quality of healthcare, they say, I want to be able to go to a doctor that I trust. I want to be able to stay with the doctor that maybe I've had forever, right? And so we are part of 2 PPO networks. They're the largest in the country. That means that you can visit nearly any doctor or specialist that you want for, you know, those day-to-day services, right? When it comes to emergency or getting surgery, all of those big things, right? That becomes an open network. That means you can get whatever care you need and go to whatever doctor you need to go to. And so really being able to trust that you can go to the doctor that you want to go to is important. And so there's a few things that we do to keep this so affordable. I feel like the next question I always get asked is how are we being able to save so many people money, right? And so there's a couple ways that we drive down these costs for these particular health plans. Number one, these plans are for people under 65. That means that if you're over 65, we're going to be able to help you and get you on Medicare. That's going to be the best option available. Number two, smokers pay $50 more a month. Smokers are totally allowed on this plan. They just pay $50 more a month. And that helps us to pay for any of those tobacco-related diseases, right? And then number three, pre-existing conditions from the past 12 months are not covered on the plan. That doesn't mean that if you have a pre-existing condition that this isn't the right plan for you and your family, okay? What it does mean is I want to encourage you to talk to one of our benefit consultants. Healthcare is super unique, and talk to them and see whether or not this plan is the right plan for you and your family. There are quite a lot of things that you might consider as a pre-existing condition that are not going to be considered a pre-existing condition. So definitely, I want to put that out there. Go ahead and talk to one of our benefit consultants, and they will be able to help figure out what plan is right for you. And so the way that this works, right? I've been talking about this day-to-day piece and then the major procedure piece, right? So we work with a few different groups, and we're able to combine these different pieces of insurance and non-insurance to create a really amazing plan that saves our members money, right? So for that day-to-day coverage, you can think about your plan in 2 big pieces, the day-to-day and then major procedure. For the day-to-day, that's actually called a MEC. So it's minimum essential coverage. You can think of that as what provides like your doctors, prescription drugs, diagnostics, those things that you're more frequently using, right, are going to be under that minimum essential coverage. And so that is run under our partner Boomi, and you'll have an insurance card for that, right? That portion of the plan. The other side of the plan is actually through a health share. And so that is going to take care of all of the big things that happen to you, right? So if you need a surgery, if you go to the emergency room, if you get admitted to the hospital, if you get diagnosed with something, right? All of that is going to run through ClearShare, which is our health share. And so with that, you will actually have a couple different annual limits that you'll choose. Okay. So for the day-to-day care, it's a $0 deductible. You can start using that immediately. You don't have to pay anything right there. You'd use it however your plan is. You'll have either a copay or an HSA option. For the major procedure, you'll have these 3 limits that you can decide which is going to be best for you and your family. So we do it at $1,000, $2,500, and then $5,000. So for instance, myself, I'm on the $1,000 plan. Okay. That means that if I go out and break my wrist, I'm going to pay $1,000 for anything related to that. Right. And then after that $1,000, my healthcare is going to cover it 100%. If I go out and break my other wrist, right, or my ankle or whatever it is later in the year, my healthcare is going to be covering that 100% because I've already reached that annual max. Okay. So really, really incredible. When I was talking about decreasing that financial risk, decreasing that out-of-pocket cost, that is where it happens. There are no limits on those. There are no, percentages that you'll have to pay. It is literally just that amount of money that you've chosen for your annual max. So you don't have to be worried about any of that. And I would definitely encourage you to look at the plan that you're on right now, see what those annual maxes are, and really compare and contrast that. We also, again, have supplemental insurance, and that will help to cover other pieces of this. And so with all of the plans, you have access to some really, really great things. Number one, there's free teledoc on all of our plans. That means you have unlimited use, $0 copay, and 24/7. You also have all of your preventative care included in all of your plans, okay? We also have care coordination. This is really incredible. And if you guys have been on any of the presentations lately, we've definitely tried to emphasize this. This is one of the ways that we're able to help you guys save money, help you figure out those major procedural things that happen, where we're able to work hand in hand with you, find doctors, look at costs, make sure that we're keeping those costs down. If you have a surgery or, get diagnosed with something, I really encourage you, once you become a member, to get in touch with our care coordination team. By saving money on a couple different areas where we're able to actually negotiate with the providers that you're going to, we're able to pass that savings on to you as a member. And so when we pass that savings on to you as a member, that means that we are waiving your annual max. So say you are on the $1,000 plan or $2,500 plan, right? We can waive that annual max when you're working with the care coordination team to schedule those different things that you might need. So really incredible, just another way that we're trying to bring that cost down for your healthcare. We also have mental health benefits available. And so those are included through our partner Talkspace. And so definitely really incredible benefits there. We also encourage expert second opinion services. So when you get diagnosed, when you feel wrong, I like to bring this up in every presentation that I go into. Go seek a second opinion. It is so important. It can be life-saving. I'll take an example just from our Clearwater family. One of our account managers, she actually got diagnosed with bladder cancer 3 years ago. And she got that diagnosis on her second opinion. They didn't see it on that first visit. And she was able to start her treatment so much earlier. And because of that, she is cancer-free now. And after all of that treatment over the past, 2-3 years, she still goes in and gets checked and all of those things, right? She's only paid $1,000 each year for that treatment. That is incredible. And so definitely want to highlight the service, not only, but like also how much you actually are paying for this. Again, another piece of this is that there are no enrollment deadlines. That means that you can enroll at any time. And so just to kind of bring it all together, give you that full overview, when you go to pick a plan, there are a couple different decisions that you have to make. Number one, you want to figure out what day-to-day coverage you want to have. And we've got 3 options for that, okay? You've got your advanced, your basic, and your HSA plan. I feel like I wrote on here, I don't know if you guys see that red mark, but just let it go. It's going to be there. The advanced plan and the basic plan are both copay plans. That means that you have copays for your doctor's visits, prescription drugs, all of that. The advanced plan actually has copays for diagnostics as well. So labs, x-rays, urgent care, those kind of things. And so the basic and HSA plans are going to be the more affordable options. The advanced is going to be a little bit more. Your HSA plan is actually a health savings account. If you've used that before in the past, that's a thing that's available to you in these plans as well now. So you'll actually use that HSA account for those day-to-day services. Again, you have access to preventative care and teledoc fully covered on that plan as well. The second decision that you have to make is how much you want your annual max to be. So when a major incident, major procedure occurs, how much do you want to be responsible for personally, right? We've got that $1,000, $2,500, and $5,000 tier. Most of our members are going to be on those top 2 tiers, and that's because they want to take on a little bit less financial risk, right? And so that, again, is how much you pay before your healthcare is covered 100%. Then your supplemental insurance, dental, vision, accident, critical illness, and life. And so definitely check those out and talk to one of our benefit consultants about that. For enrollment, again, it's open year round. So you can go to myagenthealth.com and I'm actually going to show you here in a second how to do that. But there's 3 easy things to do. Number 1, get a quote. Right in the top corner there, it says quick quote. I went ahead and posted the website right in the chat box. Go ahead, open it. All of you guys are already on your computer. Let's go ahead and do this right now. Open that up and right there in the right-hand corner is the get a quote. I think it says quick quote. And it's about 6 questions. It takes about 30 seconds and you'll actually get a quote for how much it will cost for your healthcare. And you'll be able to see all of the different information for that. And then you can pick your plan. I would suggest that you schedule a benefit call with one of our benefit consultants. They are so amazing. I can't emphasize it enough. They really make it as easy as possible for you to figure out what healthcare plan is best for you. And then enrollment is online. It takes less than 5 minutes. You can do it directly from the website. And then you'll be set up. You'll have access to our app where you can get your insurance cards. You'll be able to do teledoc, find your providers right through the app, all of those really amazing things right there in the app. And so I do want to highlight just one more thing. I think it's really important to talk about this with your sellers, anybody that is trying to build their team up. Use this as a tool. This is so important. You know, one of the biggest struggles for people when they decide to go and be self-employed is finding healthcare. So knowing that Powur has really stepped it up, found a partner to bring this healthcare to them, found somebody that's affordable and is ready to help them out is really important. And so definitely talk about that with them. Tell them about how much it means to have a company that actually cares about your health and well-being. If you are talking to someone, definitely feel free to reach out to me. I can help them, get a quote, book a call, whatever it is. I've got flyers and testimonials, presentations. We will be doing webinars. You have lots of information right there in our partner page as well. So super, super easy to get them the information that they need before they even sign up. They can get a quote, right? So they'll know, or before they maybe switch out of their current role, right? They can know how much it's going to be costing them for their healthcare. And that will definitely, I know it will help them make that transition. You can also use this as a tool for your ambassadors. So not only are you, helping them out with that amazing $1,000, right? But also if they're looking for healthcare, maybe they work for themselves. Maybe they're paying a ton of money to the healthcare exchange. And you can help them out by suggesting that they sign up with Clearwater for benefits. Tell them to just say that they're part of Powur. They're a Powur ambassador, and they'll be able to sign up with those benefits. Okay. And so again, also, if you have a team, I'm happy to attend one of your team meetings. If it's a smaller group, no matter, I'm here to help. Okay. So I did post my stuff in there. I'm going to go ahead and hop out of here. I do want to address some of the questions that are in the chat. And so let me bring this up, and then I might go ahead and hop into just show you guys some quick things.
Awesome. Thank you so much, Erin. Yeah, this is exciting. I know a lot of independent contractors and self-employed people have this has always been a bugaboo in my family household, because I've been, self-employed forever and with a wife and 3 kids. It's sketchy treading waters, uninsured at certain times in our lives. So this is a great opportunity for our consultants to take advantage of.
Yeah. And so that I think that's so cool. Yeah, no, I think that it's really tough for self-employed individuals to really find quality healthcare. And it's definitely, I think one of the benefits of being with Powur is that you guys are bringing together all these different resources to make sure that you guys are supported in all of the different aspects of your job. And healthcare is just one of those, right? I love, Tom, thanks for popping in here and talking about your savings. I think that's really important. I'm going to just really quickly run through some of these questions. Open enrollment, like I said, you can sign up at any time. So that's really great. Go ahead. I think the best thing you can do is book a call. I'm showing you this right here on the website. When you hop into the website, right there, book a call, it pulls up a calendar, and you can just hop in here, pick a time, and be able to go through that. So super easy there. This is where you get that quote. And that will actually bring you to a page that looks sort of like this, but it will have a price right there for you. This has all kinds of information for you. You can download all of the information in regards to like the guidelines for the plans, but it'll really walk you through each of those pieces of the plan, right? So your doctors, prescriptions, how much you pay, labs, imaging, all of that stuff, so that you understand what's available there. Okay. So definitely check that out. It is such a good resource. Okay.
Erin, I do have a quick question for you. So like in my family household, like we have a local physician who has an office that we've subscribed. She has like this monthly subscription that we pay into, and we can go see her anytime. She can handle our prescriptions. She can do simple diagnostics. But my little baby girl breaks her wrist, something like that, or ankle. Now we're going to another doctor. And now we like her, we'd like to hang on to her, but for those major incidents, could we subscribe to a major incident plan with you guys a la carte without
Yes.
doing the day-to-day?
Yep.
We
So,
already have that
so I
handled?
talked about those two different sections of the plan, right? So you've got your minimum essential coverage, which covers all of that day-to-day stuff, right? But then you also have the health share that's for those major things. So that's what you're talking about. So what you would do is actually sign up for just Clear Share. And so what I would suggest, again, next step, and you'll hear me repeat this a million times, right?
Book a call?
Yeah, book a call, and they'll literally bring you through it and decide what's the best one. But that's definitely what you would want to do, because then
Okay.
when something happens, right, you and your family are covered.
Totally. No, that sounds great. And I know someone asked, is this for Powur individuals only? Can anybody just join Clearwater? And then is there a financial benefit of us being with Powur?
Yeah, great question. So to anybody can join Clearwater. It is open. It's a available network for self-employed individuals. When it comes to Powur, we do a lot more to help you guys, figure out all of the different ins and outs. So the customer service section is a little bit different. On the other side of that though, guys, when we're talking to your team members, making sure that you guys have not only this is available for you guys, but also for your ambassadors, if that makes sense. So definitely use it as something in your recruitment toolbox, as something that's available, and we help to facilitate for sure. But yeah, no, it is available as a tool for different self-employed individuals. Mostly we work with real estate agents. We actually don't work with anybody outside of Powur in the solar industry.
Oh, okay.
Erin, I had a question. First of all, this is really big for a lot of people who start with Powur part-time and they have a full-time job someplace else with, health coverage. And sometimes what's keeping them in that full-time job that they may not want to stay at, is the health coverage that they get as a part of their compensation. So, just everybody think about that as you're talking to people, or maybe even for yourself, if Powur is a part-time gig for you and you want to go full-time. But my question, Erin, is, so if somebody has a basic or advanced plan, can they also have a health savings account?
No, not through this plan. So I actually don't know if you're able to get a health savings account outside of that, just on your own, right? But not through the plan, no.
Okay, all right.
Either or. And if you had the basic or advanced, like you're already saving a ton of money, right? On those basic services, and that's where that savings comes in.
Mhm.
So that's where the difference is.
Got it. Okay, thanks.
Yeah. I do have a few direct questions in here. And so I'm going to go ahead before this ends. If you've messaged me directly, go ahead and send me your email address so that I can respond to you via email. Okay. And I'll just take it out of the chat. I do want to just mention, I don't know if you guys have anybody on your teams that are Spanish speaking or anything like that, but we're having a presentation in solar, Spanish, I think it's Solar University next week on Monday. And so it's a Spanish presentation. If you guys are interested in that, feel free to send me a message and I'll get you the Zoom link for that if you don't already have it. That'll be happening on September 12th at 10 a.m. PST. So definitely want to encourage you. We also will have some different things available for Spanish speakers coming up in the future here. Again, you can find all of this information right on our partner page as well. I'm sure they will be sending out the recording of this just in the general notes. But yeah, no, definitely. I think the biggest thing to do, y'all, is hop on the website, get a quote, and book a call. With that, I'm going to go ahead and send it back over to you guys. just because we're getting really close to that time.
Yeah, we are. Thank you, Erin. Really super appreciate that. And I did have another question for you. Is this, I know some of these, sometimes situations like this, the healthcare provider asks you to maybe collect the bills yourself, send them in, and then they pay for it? Or is this an actual like insurance card where they're billing Clearwater?
So it works both ways, right? So depending on what this is a little bit more so it works two different ways. Okay. So one of the ways for all of your day-to-day services, they're just billing it directly to the insurance, right? So when you go into the doctor, like you get a lab, whatever it is, it'll just go right into your, they'll work directly with the provider. When it comes to like those big things, right, you will submit a claim and collect those bills right until you get to a certain point, right, till you meet your annual max. And at that point, we will be taking over that claim completely. So your doctor would be sending those bills directly to us, and us meaning, the health share. And so that would be happening directly with them, right? It wouldn't be you collecting all of those bills after that. So the important thing I'd say in any of those cases is just to submit that claim, get that started, because what that does is allows us to be able to take those bills directly.
Yeah, because that's the headache.
Yeah.
Mom or dad wants to deal with bills and collecting. I mean, it can be overwhelming,
Yes.
for families and stuff like that. So you guys do take that on. That's great.
Yeah. So at the beginning, you definitely would be collecting some of those bills up until that point, and then we take it on 100%.
Okay.
Yeah. And I saw in here, and guys, I'll stay on a little bit afterwards, if that's all right, guys. So you can kind of end the meeting. If anybody has questions, they can stay on as well. Is that okay?
Yeah, that's fine. Tom, I do have a hard 11. I kind of got to jump off here. I don't know if you can.
Well,
still
feel free
manage
to
the
send me
call,
those.
I can stay on a bit, Erin. We've got a few more questions if you want to answer those.
Yeah.
Let me stop the recording.
Cool.
Thanks everyone for joining us today.